class number 4 of the course of Axial Anatomy 1 in the Florida National University. Abdomen. This is the first thing that we are going to review today. You remember in the last class I told you that are very important to review the reports of the patient before you begin the new ultrasound study, and to understand the review that is written by doctor, by radiologists, you need to remember the 9 areas of the anterior wall of the abdomen. The 9 areas of the abdomen are very easy to remember because in the left side you have the same that in the right side. Right hypochondrial region, this is a very important area. A lot of organs are there. Epigastric, that means over the stomach, and the same left hypochondriac region. In the center, the umbilical region, very easy to remember. Right lumbar, left lumbar, the area where are the kidney. Right iliac regions, the appendix. Hypogastric region, a lot of organs are there. Uterus is the most important in the female. Prostate also is there. Urinary bladder, and in the left iliac region that there are no many organs good for ultrasound. This is the same that the other, but this is that you can see inside, and you can see that different organs are in different regions. There are organs like the liver that is so big that touch 3 regions. Is in the right hypochondrium, is in the epigastric region, and also is in the left hypochondrium, and also a little part of the liver can touch the right lumbar region. How to divide the abdomen? The first is 2 midclavicular lines, 2 vertical lines that go over the middle part of the clavicular bones. From the middle part of the clavicular bones, vertical, like sagittal, cutting all the body. Same in the left side. From the midclavicular line, a sagittal line to the inferior part of the body. The other line is called transpyloric line because it's supposed to pass over the pyloro. Remember that the pyloro is the valves, the distal valve of the stomach. In reality, it's coming behind the cartilage of the thoracic cavity. And the other are the intertubercular plane that are coming. The landmark to have the intertubercular plane is the hip bones. You can see here midclavicular line, sagittal plane, midclavicular line, transpyloric, and the other that is the hip reference. This is the picture with the organs that are deeper. The same picture with the 9 quadrant with organs that are deeper. Viscera. Viscera, the soft internal organ of the body, including lung, heart, and organ of the digestive, excretory, and reproductive system, are special organs that are inside the abdominal and thoracic cavity. Viscera. This is the explanation of how the viscera are covered by a double membrane called serosa. In this case is called peritoneum. The peritoneum is the serosa membrane of the abdomen, and here is the explanation of the serosa membrane. Exactly like pericardium, exactly like pleura. This is the visceral peritoneum covering the organ, and this is the parietal peritoneum covering the wall of the abdomen, and this is the peritoneum cavity or the peritoneal space that is generally empty, only have a little quantity of serous fluid. It's working similar to the pleuras, working similar to the pericardium. All the three are serous membranes that cover organ inside the closed cavities of the body. There are organs that are intraperitoneal and there are organs that are retroperitoneal. It's very easy to remember because the retroperitoneal organs are less than the intraperitoneal organ, and one organ or is intraperitoneal or is retroperitoneal. Of course, organ of the abdomen cavity. Stomach is intraperitoneal, liver is also intraperitoneal, gallbladder, that is very good for ultrasound, is also intraperitoneal, spleen, that is in the left side, in the left hypochondrium, a small bowel, that is a big part of the content of the abdominal cavity, colon, uterus, ovaries, and the urinary bladder. All these organs are intraperitoneal. All these organs are covered by a visceral peritoneum. Our intraperitoneal organs are covering by the visceral peritoneum. Other organs are not intraperitoneal, are retroperitoneal, and are easy to remember the retroperitoneal organ because the most important are the kidneys and the pancreas. All of these organs are retroperitoneal. These organs are not totally covered by peritoneum, are inside the body but are not inside the peritoneal cavity. Aorta, ureters, and IVC, all the three are pipellines, and all the pipellines are in the retroperitoneal organs. Kidneys and pancreas are the most important to remember. All the other organs are intraperitoneal. Remember, kidneys, pancreas, aorta, IVC, and the ureters are retroperitoneal organs. We are going to review different organs that are in different quadrants, what are good for ultrasound, what are not very good for ultrasound. In the right hypochondrium, we have the liver. The liver is the most important organ for ultrasound in the abdomen cavity. If it's not the most important, it's one of the most important. If you are sonographer, you are going to scan the liver every day. It's very important, it's very good for ultrasound, it's very easy to scan, not always, but it's a big organ, and this is not hard to scan. The gallbladder is other important organ for ultrasound that is in the right hypochondrium, and the right kidney. Also, the right kidney is not only in the hypochondrium, the right kidney is in the lumbar area, in the right lumbar region, but is a little part is in the right hypochondrium. In general, right kidney is not scanned from the right hypochondrium. It's scanned coronal or is scanned through the thoracic cavity. Small intestine, ascending colon, and transverse colon are not good for ultrasound. Are the organ have gas. When one organ have gas inside, like the stomach, is not good for ultrasound. To review, the right lobe of the liver is in the right hypochondrium. Very good for ultrasound and very important. You can see here in the right hypochondrium there are a portion of the liver, but even there are only one portion, a lot of part of the liver that are not properly in the right hypochondrium can be scanned with ultrasound through the right hypochondrium. You have here a picture of ultrasound of the liver, and you can see the landmark that is the hyperechoic structure that represent the diaphragm. Everything here is the parenchyma of the liver, the material what is formed the liver. You have here a picture of the gallbladder, normally anechoic, no stones, no shadows. This look like a normal gallbladder. The other structure can be the portal vein or the inferior vena cava. Okay, liver, gallbladder, and the right kidney, a little part of the right kidney. Right hypochondriums also have a little part of the right kidney, but even the kidney is not always scanned from the right hypochondrium. In general, it's scanning from the coronal, from the lumbar region. You have here a picture of the right kidney with the typical orientation: anterior, posterior, superior. This is the superior pole of the kidney. This is the inferior pole of the kidney. Remember orientation: anterior, posterior, superior, that is superior pole, and the inferior, and here is the inferior pole. Right kidney, right hypochondrium. Epigastrium. The liver also is in the epigastrium. It's also the pancreas. The pancreas is a hard organ to scan. Remember that the pancreas is retroperitoneal and the stomach is anterior to the pancreas. In general, the gas that have the stomach make hard to scan the pancreas. It's an organ that we use ultrasound, not always is easy. Right and the left kidneys are generally not scanning from the epigastrium because there are a lot of gas. Is the stomach, is the bowel. In general, the right and the left kidney we scan from coronal planes. A spleen is other organ that have a little part in the epigastrium but always is scanning intercostal. The spleen in general is better scanned when you go intercostal through the intercostal space. Right and left adrenal gland that you can scan and you can see are in general not a very common protocol. The disease of the adrenal gland in general are done by laboratory examination, but sometimes you can find a cyst or tumors in the adrenal glands. Esophagus, stomach, and small intestine and transverse colon are organs that even have part in the epigastrium are in general not good for ultrasound. Liver, this part of the liver in the epigastrium. Pancreas, retroperitoneal, behind the stomach, not easy. And you have here one ultrasound of the pancreas in transverse orientation. This is the aorta, this is the IVC, this is the superior mesenteric artery, this is the left renal vein that course between the superior mesenteric artery and the aorta. This is the confluence with the splenic vein, common bile duct, dilated, because common bile duct in general are little than this, and this one is possible to see the gastroduodenal artery. Liver, here, pancreas, everything here is the pancreas, head, neck, body, and tail. Aorta, IVC, confluence. Remember the orientation is anterior, posterior, right, and left. The orientation in ultrasound when the landmark of your transducer or the orientation mark of your transducer is at 9 o'clock. The pancreas here is indifferent, but the majority is here in the epigastrium, but it's a hard organ to scan. Epigastrium, the kidney have areas in the epigastrium, but the kidneys in general are not scanned through the epigastrium, are scanning from lateral positions and also coronal planes. Epigastrium have a little part of the spleen in general. Sometimes the tip of the liver or left lobe and the spleen touch together in the epigastrium, but the epigastrium is an organ that is more in the left hypochondrium. You can hear a picture of the spleen, but this picture is looking that is more from intercostal hypochondrium, left hypochondrium or intercostal. You can see here the spleen here, the left kidney here. The orientation is sagittal. Epigastrium, the right and the left adrenal gland that I told you are not a common protocol. You can scan always that you can find a pathology, cyst, tumors, hyperplasia is not easy to detect with ultrasound, but even the protocols of the adrenal glands in general are not common. Left hypochondrium, a little part of the liver, a part of the pancreas that is not the easy part to scanning because the shadow of the colon interfere with the image, the left kidney that is scanning from the left coronal plane, and the spleen that is the organ that have the majority of the left hypochondrium. But even is in the left hypochondrium, the spleen is scanned from the left intercostal space. Stomach, small intestine, transverse colon and descending colon are organs that even are in the left hypochondrium are not good for ultrasound because have gas. Pancreas here, left kidney and the spleen. Right lumbar area, a little part of the liver, the gallbladder that is there, and you can scan the gallbladder in general from the right hypochondrium, but you can move in a little and to be in the right lumbar region, and the right kidney that even is in the right lumbar. Not always you are going to scan it from the right lumbar region. You get the best position to get the right kidney, and sometimes it's coronal plane, sometimes is intercostal, depending of the patient. Small intestine and ascending colon, no good for ultrasound. Liver and gallbladder. Liver and gallbladder, you can see here in the right lumbar area, a little portion of the liver and the fundus of the gallbladder. This point here is called the Murphy point and is very important in ultrasound. Right lumbar, the right kidney is there, and you can see here the portion of the right kidney that is in the right lumbar region. Umbilical, no good region to scanning. There are a lot of gas there, a lot of bowel. In general, we prefer scanning from the lateral areas, looking the center, not from the center, looking the lateral areas. But in the umbilical area, there are an area of the pancreas, and also there are a little portion of the right and the left kidney. Even we do not scan kidneys from the umbilical region. Pancreas, kidneys, but not for scan. A lot of gas in this area, no always good for a scan in the umbilical region. Left lumbar, only the left kidney is the important organ that is in the left lumbar. Remember, the small intestine and the descending colon are organs that are not good for ultrasound. Left kidney, Right iliac is an area where is the appendix. Sometimes we scan in the appendix to diagnose appendicitis. It's not a very sensitive examination, and no doctor is going to order a appendicectomy only with ultrasound. The diagnostic of appendicitis is a complex diagnosis that only ultrasound can help, but is not the principal device to make the diagnosis of appendicitis yet. Right fallopian tube. Fallopian tube are only visible with ultrasound when there are disease, when the fallopian tube are filled with fluid or filled with pus, or when there are ascites in the abdominal cavity that led you to find the fallopian tubes, because the fallopian tubes are confused by bowel, are very similar and are not easy. Only when there are fluid you can detect the fallopian tubes, the right or the left. And the right ovary, a very important organ that is mobile and not always is in the right iliac area, because sometimes can be in the hypogastrium near the uterus, but sometimes is in the right iliac area. A small intestine and the ascending colon are in general not organ for ultrasound, with the exception of the appendix that in general can help to the diagnostic of appendicitis. Right ovary, you can see an ultrasound picture of the right ovary. The appendix that is here in a picture, and this is the appendix in a ultrasound picture. This is the appendix here. Not easy to get good picture, not sensitive for the diagnosis, but help doctor to make the diagnosis of appendicitis. Hypogastrium, right and left ureters. Remember, ureters are not good for ultrasound, are so retroperitoneal. There are a lot of bowel, anterior and in general the gas that is in the bowel don't let to visualize with ultrasound good the ureters. It's a very important organ. There are pathology. Doctors in general are interested in localized stones or inside the ureter, but ultrasound is not very sensitive for a stone in the ureters. Urinary bladder, good organ for ultrasound. There are more diagnoses than ultrasound, but urinary bladder is an organ that you can visualize very easy with ultrasound when it's full of urine. The uterus, very important organ for ultrasound, is the organ of the pregnancy. You cannot use X-ray for pregnancy. Ultrasound is the best device to diagnose disease of the pregnancy and disease of the uterus. Right and left ovaries sometimes are in the hypogastrium and are an organ that are very important for ultrasound, because you cannot use X-ray in the ovaries because you can produce congenital malformation or even infertility. Prostate, that is more to take biopsies, are other organ that is in the hypogastrium, but in general we scan the prostate endorectal to make biopsies. Small intestine, sigmoid colon and rectum are not good for ultrasound. Vas deferens is not a typical organ, and the seminal vesicle, even you can see with ultrasound, are not a common protocol. Hypogastrium, the ureters that are not easy to scan with ultrasound, are retroperitoneal organ, are in the center of the body and have a lot of bowel and gas anteriorly. The urinary bladder is a good organ for ultrasound. Very, very good. You can see different disease. Cancer of the urinary bladder. You can see stones in the urinary bladder. Cystic cystitis is other disease that you can determine with ultrasound when you scan in the urinary bladder. Also, in the urinary bladder for people that have hyperplasia of the prostate because have problem with urination. You can see here an ultrasound of the urinary bladder. I think it's in transverse. This area here is possible the prostate, and this anechoic area is the urine that is inside the urinary bladder. Very easy protocol, very common protocol, and a lot of times when you scanning the kidneys, you also scan the urinary bladder. Sometimes doctors want urinary bladder with pre-void and post-void volume to determine the residual urine and the percentage of urination. Hypogastrium, the uterus, very important organ for ultrasound, is the organ of the pregnancy. In pregnancy, you cannot use X-ray. In pregnancy, you cannot use CT scan. In pregnancy, the best device to make diagnosis is the ultrasound, but also in the uterus not pregnant, ultrasound is very good. Hyperplasia of endometrium, endometriosis, a lot of different diseases can be diagnosed with ultrasound. That is an organ relatively easy to scan. Uterus, this is an endovaginal, this is not transabdominal, this is an endovaginal uterus because the urinary bladder is not anterior and full of urine. You can see here the fundus of the uterus, the body, the neck, and the endometrium, this hyperechoic area that is very important to determine the menstrual cycle. Hypogastrium, the ovaries that sometimes are in a hypogastrium, not always. Remember, ovaries are mobile inside the peritoneal cavity, and sometimes in the hypogastrium. In general, ovaries are not easy organ, but it's necessary to use ultrasound because the ovary are not for X-ray because have the information of the DNA. Hypogastrium, the prostate, that is an organ that you can see with ultrasound, but is not enough sensitive to diagnostic cancer. We use ultrasound in the prostate, transrectal, and in general to take biopsies. This is the prostate, the hypoechoic area. This is a transrectal scan looking that the orientation is from low to up, is different than the other. This is the transducer here in the inferior part of the screen. Left iliac, the left ovary, when it's there, the left fallopian tube that you can visualize when there are fluid inside the fallopian tube. Small intestine, descending colon, and sigmoid colon are not good for ultrasound. Descending colon and sigmoid colon use endoscopy to looking inside. Left iliac with the left ovary. This is the other division of the abdomen that is very easy to understand. Right upper, left lower, and right lower. You can see that the organ that is in each quadrant are more than in the other division of the abdomen. In the right upper quadrant we have liver, gallbladder, the head of the pancreas, the right kidney and adrenal, but the duodenum, the hepatic flexure of the colon, and the ascending and transverse colon are not good for ultrasound. Left upper quadrant have the spleen, a part of the liver, the body of the pancreas, the left kidney and adrenal, and are not good for ultrasound, the stomach, the colon, and the descending colon. Right lower quadrant, the appendix, the right ovary and the fallopian tube, and the right ureter. Second and right spermatic cord are there, in general not good for ultrasound. Remember that the appendix is only for diagnostic of appendicitis, not very sensitive, not very easy, and not very common protocol. Left lower quadrant with the left ovary and tube and the left ureter is a part that really we scan only the ovaries. There are not other organs important to scanning in the left lower quadrant. Part of the descending column, the sigmoid column, and the left spermatic cord that are there are not organs that in general we use ultrasound. In the midline of the abdomen we have the aorta, a very important organ to scan because there are the abdominal aneurysms of the aorta. This is a very common disease, a very dangerous disease, and a very important disease to make following. Aorta ultrasound is a very common protocol in the middle line of the abdomen. The uterus, exactly that we're talking when we're talking about the Hypogastrium, is a very important for ultrasound with the urinary bladder. Okay, we are going to make a little review. The liver, I recommend you make the same picture. The liver, the gallbladder here, the right kidney, the spleen here, left kidney, left adrenal, right adrenal, uterus, urinary bladder, fallopian tube, right fallopian tube, left fallopian tube, right ovary, left ovary, aorta with the bifurcation in the common iliac and the inferior vena cava that also have the confluence from the common iliac veins. Remember, liver, spleen, right kidney, left kidney, aorta, IVC, uterus, urinary bladder, fallopian tube, right ovary, and left ovary. This is the most important organ for ultrasound, and it's very easy to remember what is the position. But remember, when you have one organ in a region, that don't tell you that you must scan the organ from the same region. You have the liver and you can scan the liver from other position. Even you can scan the liver from the thoracic cavity through the intercostal space. This is other picture with like a CT scan, the falciform ligament, the stomach here, not good for ultrasound, the spleen, that is a good organ for ultrasound, right and left kidney, the pancreas, and here a very important area that is called the Morrison pouch. The Morrison pouch is between the right kidney and the liver, is the area where free fluid first accumulate. Morrison pouch. And the end.